Hi everyone, this presentation covers Chapter 6 on the National Health Interview Survey in the textbook Big Data for Epidemiology, Applied Data Analysis using National Health Surveys. Here is an outline of the chapter. Section 6.1 will be an introduction. Section 6.2 will cover data collection. Section 6.3 will cover the data files. Section 6.4 will cover the strengths and limitations of the survey. Section 6.5 will cover the design features. Section 6.6 will be a bulk of the chapter covering a case study looking at influenza vaccine among Arab American immigrants. Section 6.7 will be a summary, and Section 6.8 will include the references. Section 6.1, Introduction. So here's just a little bit of introduction about the National Health Interview Survey, or NHIS. The NHIS was started in 1957 by the National Center for Health Statistics. The survey is administered annually and is a cross-sectional design. So families and individuals are surveyed one time and then they're not followed up in the following years. Data are collected using a computer-assisted personal interviewing system. These are face-to-face interviews in individuals' households, and the purpose is to monitor and explore trends in the health status and healthcare utilization among adults and children in the United States. Section 6.2, Data Collection. So prior to 2016, the NHIS used a multi-stage area probability design. This included 400 primary sampling units covering all 50 states and Washington, D.C. It oversampled underrepresented minority populations, including non-Hispanic Black, Hispanic, and non-Hispanic Asian individuals. From 2016 to 2018, the design was modified to include more robust state-level estimates. The design was changed to include 300 clusters located within each state as the sampling units. It also oversampled 10 of the least populous states in the U.S., as well as Washington, D.C. In 2019, the survey was also redesigned to streamline different sections and reduce response burden. For example, individuals may be asked questions about disability among people in their household in the family file, but then also, if they are selected as a sample adult, they may have to answer additional questions. Therefore, streamlining the person and sample adult sections may reduce some response burden. The redesign also includes plans for long-term periodic and ongoing topics and incorporation of new methodologies. At the time of the development of this textbook, the 2019 data are not currently available. If you want further details on the NHIS sampling design and data collection methods, they can be found on the NHIS website here. Section 6.3, Data Files. So the NHIS has two types of questionnaire files. There are core questions that are collected on an annual basis, as well as supplemental questions that are collected on a periodic basis. The core questions are the typical demographic questions on age, sex, gender, socioeconomic questions, as well as health insurance status and access to care. Supplemental questions may be something like the list of 2018 supplemental questions here. They could involve questions on food security, healthcare access and utilization, occupational health, cancer screening, functioning and disability, immunizations, e-cigarettes, and other tobacco uses, heart disease and stroke, and asthma and immunizations among children. Often those supplemental questions are asked each year, but they may change based on the funding that's provided from the different organizations. So for example, e-cigarettes was not asked consistently a few years ago. However, now it's asked on an annual basis and will most likely continue to be asked on an annual basis. Section 6.3, data files. So the core data files that are collected are the household, family, person, sample adult, and sample child. There are also periodic modules such as the cancer control module that is collected every 5 years, and the complementary and alternative medicine module. Again, with the redesign of the NHIS in 2019, I believe that the person file may be incorporated into some of the other sections. I will go over the household, family, person, sample adult, and sample child data files in following slides. Section 6.3.1, household file. So the household file includes data that's been collected from one adult member of each household. The household file is meant to include information on the relationship and demographic factors of all members of the household. The variable that is included to identify households is HHX, and so topics that are included within this file may be the type of living quarters, the number of families, the number of persons living in each living quarter, and the region where they live in the United States, such as the Northeast, the Midwest, South, or West. Section 6.3.2, family file. So the family file goes beyond the household file because there may be more than one family living within a household. One adult member of each family answers questions about each adult and each child member of the family. However, any adults can respond for themselves. A family is defined as a group of at least two related persons living in the same household or unrelated individuals living together, such as an unmarried couple. The variable used to identify families is the FMX variable, and some other topics that are included within the family file are telephone use, family member disabilities, family level income, health insurance, and government assistance programs, such as WIC. In the past, when I've used data from the family file, it is typically to denote the family level income versus individual income that is collected in the sample adult file. Section 6.3.3, person file. So going further, the person file includes information from all adults and children within each household. And each person has a unique identifier. So each person will have their household number, their family number, and their person number. The variable for the person file was PX for the years 2000 to 2003 and FPX for 2004 onward. Other topics collected within this file include demographic information, socioeconomic information such as education, health status, limitations of activity, healthcare access and utilization, health insurance, and English language proficiency. Also, information about where someone is born, so whether or not they were born in the U.S. or whether or not they were born in a country outside of the U.S. is included in this file. Section 6.3.4, Sample Adult. So in the Sample Adult file, one adult per family is randomly selected to answer questions regarding their own health, or if they're not able to respond for themselves, questions can be answered by a proxy. There is a variable within the data file that identifies the sample adult called a stat flag, and so it's a sample adult flag. Topics in this section include health behaviors, frequency of computer use, as well as the questions on health information technology, satisfaction with healthcare received, perceived neighborhood social cohesion, and sexual orientation and HIV testing. Questions added to this section have changed over the years and often are pilot tested for 1 year and then added on a consistent basis in the following years. For example, the questions on health information technology were first asked in 2009. Then they were not asked in 2010, and they've been asked on a consistent basis since 2011. Section 6.3.5, Sample Child. Similar to the sample adult file, one child per family is randomly selected as a sample child. Information is collected from an adult who is most knowledgeable about the child's health. Similar to the sample adult file, the sample child is identified in the person file with a child stat flag. Topics in this section include child health conditions, limitations of activity, health status, child mental health, and child influenza vaccinations. Section 6.4, Strengths and Limitations. There are several different strengths and limitations to using the National Health Interview Survey for answering research questions. Some of the strengths are a large sample size, a probability sample design, the ability to evaluate health characteristics by many different socio-demographic characteristics. The NHIS has such a large sample that can be combined across years, and the information collected is pretty consistent. So you can look at several different health characteristics by age, race, ethnicity, place of birth, as well as education and other factors. Some of the limitations of the NHIS include the inability to calculate reliable statewide estimates. The NHIS does not include underrepresented subgroups. So, for example, with our study on Arab Americans, we can only look at Arab American immigrants because they are not included as an underrepresented subgroup in the racial and ethnic group files. The study design is cross-sectional, so no longitudinal comparisons can be made, and all of the data are self-reported. However, there are some studies that show that self-reported data on things like cancer screenings and preventive services can be as reliable as medical reports. Section 6.5, Design Features. So just as a note, it's important to make sure that you use the SAS survey procedures whenever you're using the National Health Interview Survey for your research question. These include the variables on clustering, stratification, and weighting. Table 6.1 includes an overview of the complex sample design variables across several years of the National Health Interview Survey. So these are the variables used for clustering as well as stratification from 2000 onward. As you can see, as the design changed, the clustering and stratification variables changed slightly. There's information on how to combine these variables if you cross the different sections. So if you include data from 2000 to 2015, you can't just combine the PSU and the PSU underscore P variable by adding them together or renaming them. You have to make some additional changes to combine data across those years, but that's all included in the analytic guidelines on the NHIS website. For complex sample designs, you also have to include a weight, and the NHIS provides interim and annual weights for each survey file. The final annual weights are most often used to provide annual population estimates. Because you cannot survey everyone in the country across the entire year, there's an interval weight included, so you can use half of the year's data file. But from my experience, you only typically use the annual weights and the annual data files. And these weights differ by the data file type. So if you are using data from the person level file, there's a person weight. If you use data from the sample adult file, there's a sample weight. And it's important to note that if you're combining multiple years, you must divide by the total number of years combined. So Table 6.2 provides an overview of the final annual weights for variables for each file type. If you're only including data from the household file, you would use the WTFA_HH. If you're only using data from the family file, you would use the WTFA_FAN weight. If you're only using data from the person file, you would use the WTFA weight. If you're only using data from the sample adult file, you would use the FTFA_SA weight. And finally, if you're only using data from the sample child file, you would use the WTFA_SC weight. Now you might be thinking what would I use if I was combining the person and the sample adult file. So you always use the weight for the smallest sample. The sample adult is smaller than the person because there are more individuals who completed the person section than the sample adult section. So if you were combining the person and the sample adult files, you would use the WTFA_SA weight. And here's how you can change the weight when you include multiple years of data. Box 6.1 includes the SAS program to create this new weight. You would include the name of the new data file that you want to create, so data new _weight. Then you want to set the old file, so for example it may be set old weight. And then you include what you want your new variable name to be. So typically I like to include something like weight 5 for 5 years of data. Or you could even do WTFA_SA5. Then I include an equal sign. Then I include the variable I want to use to divide. Then a division sign, the /, and a 5 for 5 years. Then a semicolon and a run. Okay, so in the previous slides I went over all of the background information on the NHIS. And now the next section will cover the case study, looking at influenza vaccine uptake among Arab American immigrants. Here's a little bit of background information of why we are using this as our case study in section 6.6. Arab Americans are less likely than U.S.-born whites to receive preventive services, including influenza vaccines. My colleagues and I have done some previous studies and found that Arab American women have 60% lower odds of receiving flu vaccines, and Arab American men have 62% lower odds of receiving flu vaccines in compared to U.S.-born non-Hispanic whites. Arab Americans are considered non-Hispanic whites by the U.S. government, so they do not have their own racial and ethnic category. These studies were done using restricted data from the 2000 to 2011 NHIS. In order to create the Arab American ethnicity in this sample, we limited this group to foreign-born adults who were born in 22 countries that belong to the Arab League of Nations that are geographically located in the Middle East. For this case study, I want to use some more recent data. We will determine whether the results are similar using the public use 2018 NHIS data. Instead of creating the Arab American ethnicity by each individual country of birth, we are going to use a proxy of those who state that they were of white race, non-Hispanic or Latino ethnicity, and were born in the Middle East or North Africa region. There are several efforts to create a MENA, or Middle East or North African region category, to include as a racial and ethnic group within the next census. Section 6.6.1, Specific Aims. So here are the specific aims for this case study. Aim 1, to compare the socio-demographic and health-related characteristics of Arab Americans compared to U.S.-born and foreign-born non-Hispanic whites from Europe. And 2, determine associations between region of birth and flu vaccine uptake among Arab Americans compared to U.S. and foreign-born non-Hispanic whites from Europe. In order to do that, I will follow the following methods. So section 6.6.2 in the textbook goes over each of these methods in depth. Step 1, to download the person and sample adult datasets and SAS programming files. Step 2, run the SAS programming files and create libname and impute the person and sample adult files. Step 3, combine the person and sample adult data files using a merge statement. Step 4, recode and rename the variables. Step 5, conduct descriptive statistical analysis. And step 6, to conduct inferential statistical analysis. So first we have step 1. We will need to download the person and sample adult datasets and SAS programming files from the NHIS website. In order to do that, you will go to this website here, then you click on the plus next to the data files. Under Person File, click on ASCII Data and save it to the computer. Open the zip file and save the data file to a permanent location on your computer. I recommend creating a folder on the C drive labeled NHIS and then creating a separate folder for each year. So let me go to the website and show you how to do that for the person file as well as the sample adult file. Here is the NHIS website. In order to find the data files, I can go to Survey Data and Documentation. Then I'm going to go to 1997 to 2018 NHIS. I could also just go directly to the 2018 data release right here, but let me go ahead here. 2018 is on the top. If I scroll down, I can get the person files by going to the data release. Then I click on the plus next to data files. Click on ASCII data. So my computer is a little funky, and when I double click on it, it doesn't show on the bottom. So I need to right click, open link in new tab. Then it downloads the person file. If I open the zip file, I can go directly to my C drive. Then I have already created an NHIS file. I've created data files for each year. And then there you can drag and drop the person X file here. Now let me go back to the presentation. So next you'll do the same thing for the sample adult file. Then you will also download the sample SAS statements for the sample adult and person file. These can all be saved in the same folder. So let me go back to the website. Okay, so here's the sample adult file. I'm going to right click, open a new tab. Then I can go to the sample SAS statements for the person file. Open a new tab. And also for the sample adult file. If you are using SAS Studio through SAS Academics or SAS University, these will probably show up as text files. If you have SAS downloaded on your computer, they will show up as a SAS file. So I'm going to go to my downloads. I'm going to unzip the sample adult file, which I already have saved in my NHIS 18 folder. And then you can copy and drag over the SAS statements as well. Once I have all the data files downloaded, I can move on to step 2. Here's where you run the SAS programming statements to create libraries, as well as import the person and sample adult files. In order to create the SAS programming statements, you just need to make a few different changes to what you've downloaded from the dataset. In order to do that, I recommend that you open the SAS person-level programming file. Then create a libname statement, which houses the data and files associated with the analysis. You will also create a libname statement for the survey name, such as NHIS. I recommend that you use the same location as the data files on the C drive. Create a file name statement which lets SAS know where the data file is stored, and remove any instructions which are listed in the green text that you do not need in the programming file. You can also make your own notes so that when you look at these files in the future, you know what you changed and what you may want to do differently. Then you highlight all the programming statements and click Run. You'll do that for the person level SAS programming file, and it will look something like this. I have taken the different sections and combined them into box 6.2 for a SAS program to impute the 2018 NHIS person file. Here you can see the libname statements on the top, as well as the file name here, which is the .dat file. Then it goes through and includes the formatting, as well as the name of the data file, each of the locations of the data file, as well as an additional statement to link the formats into the data file. So unlike the examples in the previous chapters, you will have some labels and formats here in order to make reading your outputs clearer. You will do the same thing with the sample adult SAS programming file, and you'll have a very similar SAS programming set of statements that you can use to import the data file here as well. And this is demonstrated in box 6.3. So I'm going to go to the website and download these cleaned statements in order for you to see how you can import them into SAS. So here's the website that goes with the textbook. If I go down to chapter 6, I can open file 6.1, which is the cleaned SAS program to create the NHIS 2018 person file. I open this in SAS. And it looks a little bit different than the example provided in the chapter in the box, because it has all of the different formats as well as the impute statements. You can go ahead and highlight, so Control A to highlight all and click the running man. Then I go to my log, look to make sure that there's no red. And I see everything is imported correctly. At the bottom of this programming statement, there are also some additional statements here, including the proc contents and the proc freak. These are included at the end of what is downloaded from the website. I typically remove these because I don't need them at this point. However, I've left them here so that if you want to, you can go and look at the outputs, which include the proc contents, which gives you all of the different variables. There's quite a few. And then if you scroll way back down, it gives you the number of persons here, which is listed in scientific notation. Now I'll do the same thing for file 6.2 for the sample adults file. And just highlight, Control A, and click Run. Go to my log, make sure I don't see any red statements. Then I can go to my results viewer, and again it included the proc contents as well as proc frequency statements that are included from the files directly downloaded from the NHIS website. So now we have our person file as well as our sample adult file that we want to merge for this case study. So I'll go back to the PowerPoint presentation. So the next thing we want to do is step 3, combine person level and sample adult data using the merge statement. Once your data files have been imported into SAS, you can combine the person and sample adult files. Typically, I create a temporary file name for each file to indicate the type of data and the year. This is very helpful if you use multiple years of NHIS data. So you may want to call it person 18 and sample adults or same adults 18. Then you need to sort each file by the household number as well as the family number prior to merging. You can also use a keep statement to keep only the variables that are needed for the analysis. So as you saw when I did the proc contents for both of those data files, there are so many different variables and you never need all of those variables. So by using a keep statement, you can actually just list the variables that you want to keep for your final analyses. Then third, you merge and sort the combined data set with only those variables from the keep statement. By removing those additional variables that you don't need, it will allow the SAS program to run faster and present the results faster. So let me go ahead and download the file to do that and merge the two files we already created. So go to the website, go to file 6.3, SAS program to merge and recode 2018 data, download and open the file. Okay, here you can see I've left the libname statements up here at the top. Then I have included the coding for box 4, which is used to merge the data files. So let me go back to the PowerPoint real quickly. And here you can see table 6.3 includes an overview of the variables that I want to use for the case study. So when I merge the different variables together, I want to make sure that these variables are still within the data file. So first we have the design variables. These are the survey year, the household number, family number, person number, the weights we want, the primary sampling unit, and stratum. Then we have our independent and our dependent variable, as well as the list of covariates that we want to include. So our independent variable will be created with the region of birth and race and ethnicity variables. Dependent variable will be created by the flu vaccine variable, and the covariates included will be age, sex, and highest level of education. Box 6.4 provides the programming statement to merge and sort the person and sample adults files. So this is what I just downloaded to show you from the website. Here is box 6.4 in SAS. This first section shows you that I want to create a new temporary file for person 18. Within that file, these are the only variables I want to keep. I want the survey year, the household number, family number, person number, region of birth, race and ethnicity, years in the U.S., and education. Then for the sample adults file, I do the same thing. I'm going to create an adult 18 file. Then I'm going to keep survey year, household number, family number, person number, the weight variable, the stratum and the PSU, the flu vaccine variable, age variable, and sex variable. Now that I have the person 18 as well as the adult 18, I can create a statement that says, okay, I want my new data set to be all 18. So all meaning encompassing person and adult files. Then I merge the two data files. I sort them by HHX and FMX and run. And then here's the sort statement. So I not only sort, but use those variables for the merge. So let me highlight these statements and click run. Go to my log, and I can see that it merged them and sorted them. You can see the total variables here, as well as the total observations here. Now going back to the PowerPoint presentation. So once I've merged the data files together, I can recode or rename any of the variables that are needed. Questionnaire responses often need to be recoded or the responses collapsed prior to conducting statistical analysis. So for example, several questions by the NHIS include the following response options. So it may be 1 equals yes, 2 equals no, but then they have a 7 equals a refuse, 8 equals not ascertained, or 9 equals don't know. These are often made missing within the analysis or used to create some sort of imputation procedures based on other responses so that there's less missing data. You may also want to just change the way the variables are laid out for easier interpretation. So for example, NHIS includes 1 equals yes and 2 equals no for many responses, and I typically recode these to 1 equals yes and 0 equals no. You may also need to combine 2 or more variables. So for example, within the NHIS survey case study, in order to create our independent variable, we need variables on race, ethnicity, and nativity status. In order to create the categories for U.S.-born non-Hispanic whites, foreign-born non-Hispanic whites from Europe, and foreign-born non-Hispanic whites from the Middle East. So Table 6.4 has an overview of the NHIS variables recoded and renamed to meet the research names in the survey case study. Here you can see I've used the race and ethnicity as well as the region of birth variables to create the renamed variable with the categories needed for the case study. I typically like to create tables like this in Word, sometimes Excel, but I think they look nicer and are easy to refer back to in Word, that have all of the original response options, the original variables, as well as the renamed variables and recoded responses. This table shows the independent variable as well as the dependent variable for flu vaccine. For the flu vaccine, I changed 2 equals no to 0, and I made 7, 8, and 9 missing. Then the second part of the table includes the covariates. So for age, which is originally a continuous variable, I've recoded this to 18 to 34 years, 35 to 54 years, 55 to 64 years, and 65 years and older. Education is a variable that has several different categories. It also includes whether or not a child is less than 5 years old, whether or not someone refused to respond, the responses were not ascertained, or the individual does not know the response. So I recoded this to less than a high school graduate, some college or associate's degree, and bachelor's degree or higher. So box 6.5 goes over a sample SAS program to recode and rename the variables based on that table. So let me go to SAS and recode them. The SAS syntax for box 5 is included in the same file that we used to merge, which is file 6.3. So I'll go through and highlight these statements. And click Run. When I go to Log, it tells me everything that has done. It also tells me that 4 additional variables have been created from before. Before I go on, I'm going to run this additional syntax here, just because it aligns with the examples in the following data files. Moving on to step 5, conduct the descriptive statistical analysis. Your statistical analysis should always start by describing the data in the dataset. Then you can start to make comparisons, and chi-square tests are conducted to make comparisons between independent variables, covariates, and dependent variables. But as a reminder, make sure when you do this, you use the SAS survey procedures and the appropriate variables. So for this example, we have to make sure we use the weighting variable of WTFA_SA, clustering variable of PPSU, and stratification variable of PStrat. Box 6.6 includes a sample SAS program for running the descriptive statistics, or the chi-square analysis. So starting off with the first part here, we have the comparison between the independent variable and dependent variable. Our procedure is proc survey freq. Then we list the name of the potential data file. Our table statement includes the independent variable, then a star, and then the dependent variable, with the / W chi-square, which means weighted chi-square, and I've included a call for the column %. We have a strata statement for a pstrat variable, and a cluster statement for a PPS2 variable, and the weight. Then we make sure that we have a run statement at the end. The second section here goes over how you can do it with more than one variable, and so I've done that with the covariates here. In the tables line, instead of just including one variable, I have put 3 variables in parentheses before the star and then the dependent variable. In order to run these, I need to download file 6.5 SAS program for statistical analysis. This has been created as a separate file so that individuals who have trouble with creating their own person, sample, adult, and merging their files can use file 6.4, which is the permanent SAS analytic database. That can be downloaded by just clicking here and goes along with file 6.5. So let me open file 6.5. And now I see the code that aligns with section 6.6 for the chi-squareds. I'm going to go ahead and highlight the libname statements since I've opened a new file. And submit. Go to my log. I see everything runs correctly. Here, when you go to the output, you can scroll up and it gives you the cross tabulations for the results. Then you can go to the walled chi-square test, and this bottom result here is your p-value. Same for age and sex and education. So now moving on to step 6, conducting the inferential statistical analysis. So inferential statistical analysis are typically conducted after the descriptive statistics. And so in this study, we're going to be using crude and multivariable logistic regression to calculate and determine associations between race, ethnicity, and nativity status and flu vaccine uptake among U.S. and foreign-born non-Hispanic whites from Europe and the Middle East. As a reminder, a crude result is the unadjusted result. So this is just looking at whether or not someone's race, ethnicity, and nativity status predicts their flu vaccine uptake. Multivariable adjusts for other factors. So while the crude just gives us the point estimate of the 2 variables, the multivariable estimates are adjusted for other factors. So box 6.7 provides a sample SAS program for running both the crude and the adjusted results. Here you can see, in order to run the crude results, you have proc survey logistic. Then you have the name of the data file. You have the class statement, which includes the independent variable. I've included descending because I want the lowest level of the variable, so whether it's 0 or 1, to be the reference group. Then I include the model statement, which includes the dependent variable equals the independent variable, and then the stratum, the cluster, and the weighting variables. I also have to make sure I put the run statement at the end. Then this next section includes the multivariable logistic regression model. Here we have added to the class statement our age, sex, and education variables. They are also included within the model statement, and it includes the same stratum, cluster, and weighting variables. So let me show you how to run that in SAS. Here we have the code for box 6.7. I have my crude results here. And in order to determine the point estimates, you look for the odds ratios. Odds ratios are right here. Within my independent variable, the variable name is Ren group, and my Arab Americans are category 3, my European Americans are category 2, and my US born non-Hispanic whites are category 1. Here you can see that comparing individuals from the Middle East or Arab Americans compared to US born, our point estimate is 0.65. Our confidence limit is 0.386 to 1.10. Because the confidence interval crosses 1, the results are not statistically significant. Now let me adjust for age, sex, and education. Here you can see that the results changed. Our point estimate is 0.545, and our confidence interval is 0.316 to 0.937. The point estimate tells us that Arab Americans, or foreign-born Arab Americans, are 45% less likely than US-born non-Hispanic whites to receive a flu vaccine. So now going back to the presentation, section 6.7 summary. So in summary, this chapter went over a brief overview of details of the NHIS. And I discussed ways to conduct basic statistical analysis using 2018 public use data. The case study explored whether non-Hispanic white Arab American adults were more or less likely to receive an annual flu vaccine in comparison to US-born non-Hispanic whites. I also provided sample SAS programming statements for downloading and importing the data files, merging the data files, recoding and renaming the variable names, as well as conducting some basic categorical, descriptive, and inferential statistical analysis. Reporting of results and interpretation of the findings is covered in Chapter 11. Section 6.8 References. This and the following slide include an overview of the references used in this chapter. And that is it. This concludes my presentation on Chapter 6, the National Health Interview Survey, in the textbook Big Data for Epidemiology, Applied Data Analysis Using National Health Surveys. Thank you for listening.